Let's now talk about bladder 58, the soaring upward point, a Luo-Connecting point. Bladder 58 is located um, 1 tune distal and 1 tune lateral to bladder 57 or 7 tune proximal to bladder 60 at the posterior border of the fibula and at the lower border of the gastrocnemius muscle. How to find bladder 58? First, locate bladder 57 in the center of the calf between the two bellies of the gastrocnemius muscle. From bladder 57, palpate 1 tune in the distal direction and 1 tune in the lateral direction. There locate bladder 58 on the lower border of the gastrocnemius muscle. Located on the same level, which is 7 tunes superior to the highest prominence of the lateral malleolus or GB35 at the posterior border of the fibula, GB36 at the anterior border of the fibula, and stomach 39, which is 1 tune distal to the midpoint of the line connecting stomach 35 and stomach 41, and 1 finger breadth lateral to the anterior crest of the tibia. Bladder 58 is needled vertically or obliquely 1 to 1.5 tune. For its actions and indications, bladder 58 opens its channel and the Luo vessels and alleviates pain. It expels pathogenic factors from the Feiyang channel, which includes the small intestine and the bladder. It harmonizes above and below and treats hemorrhoids. For its special feature, it is a Luo-Connecting point of the bladder meridian. Okay. Bladder 58 is used as a distal point in treatment of lower back ache and sciatica. A particular function of this point is to treat sciatica when the pain is somewhat in between the bladder and the gallbladder channel in the leg. Being the connecting point, bladder 58 communicates with the kidneys and it can be used to strengthen kidneys in conjunction with kidney source points, kidney 3. In particular, this point can simultaneously strengthen the kidneys and subdue rebellious chi in the head, causing headache, dizziness, and stiffness. The point is therefore ideal to treat headaches from Feiyang rising but occurring on bladder channel against a background of kidney deficiency. It is also an empirical distal point for the treatment of hemorrhoids, and this point effect on the hemorrhoids is explained by the pathway of the bladder divergent channel which goes to the anus. To summarize, bladder 58 removes obstruction from the channel, which will manifest with lower backache, sciatica, inability to stand, and atrophy of legs. It also subdues rebellious chi from the head, which has symptoms as headache, dizziness, neck ache, occipital headache, and nosebleed. It also strengthens the kidneys for cases of lower backache, tinnitus, and dizziness. It also treats hemorrhoids, as in hemorrhoids, swelling, and painful hemorrhoids and bleeding hemorrhoids. Bladder 58 is the Luo-Connecting point of the bladder channel. An examination of its modern application compared with its traditional indications reveals a significant disparity. Clinically, it is most commonly used nowadays for disorders of the lower limb and lumbar pain, particularly for sciatic pain, which is located either along the course of both the bladder and gallbladder channels or between these two channels. This reflects the location of bladder 58 as the place where the bladder channel, which runs down the back of the leg from bladder 36, passes laterally towards the gallbladder channel on the lower leg. Its traditional indications, however, show a much wider application, characterized by excess in the upper region, sometimes with accompanying deficiency below, which is a pattern which may explain the name of the point soaring upward, as well as the alternative name flying young. From bladder 58, the Luo-Connecting channel meets with the kidney channel, strengthening the relationship between the coupled channels. According to the Guide to the Classics of Acupuncture, the Luo-Connecting points are located between two channels. If they are punctured, symptoms of the inferiorly-exteriorly related channels can be treated. When the kidneys are depleted, there may be deficiency below, manifesting as lumbar pain, coldness of the lower part of the body, inability to stand, and weakness of the legs. At the same time, there may be excessive yang rising up the coupled bladder channel to the head and manifesting as dizziness, headache, pain of the neck and occiput, heat in the head, and nosebleed. As the bladder channel descends towards the foot, its points are increasingly indicated for disorders of the spirit such as mania, and bladder 58 is the first of this. The bladder primary channel connects with the governing vessel at points do13, do14, do17, and do20, where it enters the brain, whilst the bladder divergent channel enters the heart. Since both the brain and the heart have been cited as the residence of the spirit in different traditions of Chinese medicine, these two channel pathways help explain the ability of points such as bladder 58 to calm the spirit and treat disorders of the brain such as mania and epilepsy. When pathogenic factors, principally exterior wind, attack the Feiyang channel, they may give rise to chills and fever, or fever with absence of sweating, as well as various symptoms affecting the head, such as pain of the neck and occiput, heat in the head, nasal congestion and rhinitis, nosebleed, and dizziness. The bladder 58 is a distal point of the foot Feiyang channel, is able to expel pathogens from the channel, release the exterior, and clear the upper portion of the channel. The bladder divergent channel encircles the anal region, unlike bladder 68 and bladder 56 and bladder 57. Bladder 58 is classically indicated for the treatment of hemorrhoids, swollen and painful hemorrhoids, and bleeding hemorrhoids. Finally, the Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the Luo-Connecting points. In the case of bladder 58, these are rhinitis with obstruction and pain of the head and back in excess, and rhinitis with nosebleed in deficiency.